Good afternoon. We'll now start. First of all, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video pictures. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your faces in the video. As a reminder, after the pep talk, please take the online learning evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. I'll be placing the link in the chat box. Another reminder, obtaining 25 or latest certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, feedback to this pep talk. Please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now and please show your face. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021, during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. Then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. May 17, 2025 marks the start of year number 5 for the ROJoson PEP Talk. How long the pep talk will last will depend on our enthusiasm, discipline, and perseverance. My pep talk today is entitled, Why No Need for Commercial Antiseptics in Operative Wound Care. The empowerment objective is for the lay people to have an essential understanding on why there is no need for commercial antiseptics in operative wound care as part of their health management. Contents of this pep talk will be the following. What are commercial antiseptics commonly used in operative wound care in the Philippines? Why the recommendation that there is no need for commercial antiseptics in operative wound care? What can and should be used instead of commercial antiseptics in operative wound care? Disclaimer, ROJoson PEP Talk contains ROJoson's thoughts, perceptions, opinions, and recommendations, or TPORs, culled from the experiences of Dr. Joson and writings from other health professionals. What are commercial antiseptics commonly used in operative wound care in the Philippines? Operative wound care means caring of the wounds after an operation, to clean, to remove debris, to prevent infection, to promote healing. All post-operative wounds have to be cleansed at least once a day to remove the dirt, debris, bacteria, and dead tissues, prevent infections, and to promote healing. Operationally defined commercial antiseptics as those being marketed to the public for use in cleaning operative wounds such as povidone iodine, chlorhexidine, hydrogen peroxide, tincture of iodine, and alcohol. The following will not be categorized as commercial antiseptics, though some of them are being bought in pharmacies just like commercial antiseptics. Tap water, cold boiled tap water, normal saline solution, bottled distilled water, cold boiled guava leaves decoctions. A common question asks, do you need soap to clean the wound with tap water? The answer is not really. In fact, it is not recommended. Soap, especially ordinary bath soap, can be irritating to the wound and the surrounding skin and may delay healing. So what is usually advised is gentle cleansing with clean, running tap water. Soap can be used only on the surrounding skin, but not directly in the wound itself. This helps remove sweat, dirt, or oils, but the wound bed itself should be rinsed only with water or saline. Comparing commercial and non-commercial antiseptics in operative wound care, in terms of infection control and infection rates, they are the same. Thus, there is no added benefit or value with the use of commercialized antiseptics in operative wound care. In terms of safety, specifically in terms of toxicity or injury to the cells, this is more commonly encountered with commercialized antiseptics. They tend to delay wound healing. Thus, this is the benefit of non-commercialized antiseptics over commercialized ones. In terms of pain on application, this is more commonly encountered with commercialized antiseptics. They tend to cause more pain, particularly alcohol, tincture of iodine, and hydrogen peroxide. Thus, this is the benefit of non-commercialized antiseptics over commercialized ones. In terms of cost, commercialized antiseptics are more expensive than non-commercialized ones. Thus, this is the benefit of non-commercialized antiseptics over commercialized ones. In terms of ready availability, non-commercialized antiseptics are more readily available than commercial ones. Thus, this is the benefit of non-commercialized antiseptics over the commercialized ones. Conclusion: there is no need to use commercialized antiseptics in operative wound care. Thus, refrain from buying and using commercialized antiseptics for operative wound care. Refrain from buying and using povidone iodine, chlorhexidine, hydrogen peroxide, tincture of iodine, and alcohol. Use the non-commercialized antiseptics instead, such as tap water, which is most cost-effective, efficient, cool boiled tap water, normal saline solution, bottled distilled water, cooled boiled guava leaves decoction. The reason why boiled distilled water is a consideration or is recommended is that a lot of people have reservation on the cleanliness of tap water. Why are the lay people hesitant to use tap water in surface wound cleaning, even if it is advised that it is effective, safe, and economical to use? Lay people are often hesitant to use tap water for wound cleaning primarily due to concerns about water quality and risk of infection. This hesitation is especially pronounced in developing countries like the Philippines, where tap water may be contaminated with pathogenic bacteria, making it unsafe for wound irrigation and potentially worsening wound infection and healing. Additional reasons for hesitation include the following: uncertainty about the safety of tap water. Many people are unsure if their local tap water is clean enough for wound care, fearing contamination, and infection. Preference for sterile solutions. Medical guidelines often recommend sterile normal saline for wounds, especially when bone and tendon is exposed, leading to the perception that tap water is inferior or unsafe. Strong marketing by pharmaceuticals with influence on physicians to promote the use of commercial solutions, ritualistic and maximalist physicians following the wishes of the patients without attempts to explain the effectiveness, safety, and cost of tap water. What are ROJoson's recommendations on the use of tap water on surface wound cleaning? Tap water is effective and safe in cleaning all kinds of surface wounds as long as it is clean. If one is uncertain or anxious about the cleanliness of tap water, then one can use cooled boiled water, bottled distilled water for drinking, or drinking water from a dispenser. One does not have to buy povidone iodine or chlorhexidine as tap water, cooled boiled water, bottled distilled water, and normal saline suffice in terms of effectivity in wound cleaning and in preventing wound infection. The antiseptic solutions, the commercialized one, hinder wound healing and entail more expense. Summary takeaway, I have presented the following. What are commercial antiseptics commonly used in operative wound care in the Philippines? Why the recommendations that there is no need for commercial antiseptics in operative wound care? What can and should be used instead of commercial antiseptics in operative wound care? Takeaway in relation to patient empowerment, be always in touch with reliable medical information and the use of commercial antiseptics in operative wound care. Knowledge is power. It gives power. Use the 4Ks of patient empowerment: kalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on use of commercial antiseptics in operative wound care as part of your health management. With that, I end my pep talk today. I hope I have empowered you to have an essential understanding on why there is no need for commercial antiseptics in operative wound care as part of your health management. Before we go to the question and answer portion, reminder, after the pep talk, take the online learning evaluation test exercise or OLETE for mastery of learning and have a score to get a certificate like the one shown here. Then obtaining 25 OLETE certificates will entitle one mentee to a voucher for a ROJoson medical consultation, either face-to-face or telemedical. Feedback to this pep talk, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the Q&A and interactions. Please turn on your video now. Show your faces.